A warm welcome to Decoding iSPAN Moments. Today we have a special guest with us. So before I introduce him, I would like to explain what is iSPAN Moments. iSPAN Moments is a realization where you have realized that nutrition, recovery, physical fitness, and the mental health should not be ignored for a long run, and where you have realized what the body achieves, the mind believes. So, as I mentioned, today we have a special guest, Mr. Dr. B.S. Jayaram. So, Dr. Jayaram, welcome to Decoding iSPAN Moments.
Thank you, Prasanna.
So, a brief introduction about Mr. Dr. B.S. Jayaram. Dr. B.S. Jayaram is a highly respected Bangalore-based orthopedic surgeon with over 3 decades of an experience in joint replacement and arthroscopic surgery. He has completed his MBBS from Medical College, followed by MS Orthopedics from KMC Hubli and Diploma of the National Board of Examination. He began his career at Manipal Hospital, Airport Road, and later he served as an orthopedic surgeon at St. Philomena Hospital. In 1995, he moved into UK for higher training and earned his FRCS in 1997. Since his return to India, he has been an independent practice at Sri Krishna Hospital, Bangalore from 2000 to until today. He is specialized in joint replacement and arthroscopic surgery. So let's welcome Mr. Dr. B.S. Jayaram.
Thank you, Prasanna. It's been a great honor to be here.
Yes. So when we talk about, yes, you have achieved so much, you have 3 decades of an experience. Before we start, I do have a very curious question. How many surgeries have you done so far?
On my return from UK up to here, I think it has probably crossed about 8,000 surgeries, but all majors. And I think in UK time and from 1991 till 2000, I think I can probably say few thousands, but I think I need to get into the logbook. I think probably say about 8,000 plus, conservatively.
Wow. So 8,000 surgery, with 3 decades of an experience, he had done the surgery for 8,000 people. Fantastic. So, and then this triggered me another question, right? Being successful surgeon, right? At the initial stage, right, when you are in 8th or 9th or, maybe pursuing your 10th. So what made you to get into MBBS or maybe a medical as a profession? Because it's a huge decision. And then you are also, completed your primary and secondary education in Kargal. So basically, those who are watching this podcast, he is from Malnad. He has completed his, primary and secondary education in Jog Kargal. So that is one of the famous falls, world famous falls. That's Jog Falls. So what made you to get into this profession? And then can you explain about your journey?
So I probably was just like any other kid goes to a school, and that too in Malnad. I think I'm sure that you are from Malnad, you are from Sagar.
Yeah, of course, yes.
So you got about 3-4 months of the rainy season, and the rest you play only one of those common games, etc., etc. I think I was quite a regular student. I was quite studious, and at the time when you probably get into PU, that pre-university course, either you have to take 3 streams, either science, commerce, or you have to take arts. So obviously science was the option. I was basically interested in mathematics and physics. Mm-hmm. I think I'm more onto with an engineering bent of mine. So that was the way it is. That is way back in 1979 when I was all geared up to uh, get into engineering course. My father fell seriously ill and he was detected to have a terminal cancer. He had cancer of the liver which had spread to the brain, and the doctors just gave him a few weeks or maybe a month or two. So he passed away on the 15th of March 1979. I had my exams a month later, which definitely I had to.
Yeah.
So exams went off well, and subsequently those 2 months when the results came, we had a public examination.
Yeah. Yeah.
Second PU was a public examination. We didn't have any multiple choice. We had the essay questions and the short notes, etc., etc. When the results they came 2 months later, the entire colony, Kargal colony and Jog Falls, they celebrated. I had scored 100 in chemistry,
Wow.
100 in mathematics, and 99 in physics. Purely it was an emotional decision to get into medicine at the time when I got it. I think that's all I can say.
Yes, ideally, we say it as API, right? Aptitude, interest, and personality. All three should match. So then you can perceive. This is where I would say your true calling. And then you got into MBBS later, right? As plus two, and then you have completed the entrance exam as well. So, how was your journey as soon as you complete your MBBS? Because during those time there were two booming career. One is people used to talk about engineering. Till today, also people, especially when we go back or maybe in Malnad, even today people think about engineering or the doctor, right? What is your son doing? Either they say engineer or the doctor. How was your initial journey when you have completed your MBBS? How was your journey?
If I had to probably say about my MBBS career, I think it was a bit unsettling to begin with. I think I am deeply indebted to BK Gardachar Charities. They had a free hostel at Tulsivanam Sri Vaishnava Hostel
Okay.
at Chiklalbag, which was a community hostel where I was given accommodation and two square meals, just rupees 50 per year. So
Oh,
technically it is free. The 2 years that place hosted me. Without that, to probably come to Bangalore and to do this higher education, I don't think probably it was not possible at all. So I think I'm a beneficiary of that the great man, the great place. See, at the time when we saw in the orthopedic ward at Victoria Hospital, all patients with a pelvic fracture or a hip fracture, they were lying down in the bed on a bowler bronze frame with a pin going through the tibia or the calcaneum. They used to be there for 2 3 months. The fracture used to unite or never used to unite. It used to unite with maybe with shortening, etc. They are linked with they're left with permanent gait. Or if they had to undergo a surgery, they had only what we call as a super Smith Peterson nail, what you call the SP nail. And the implants available at the point of time was for the femoral shaft fractures, we had only what you call as the K nail. For tibia, we had a V nail. We have got the basic plates. We have got what you call K wires and rush rods. Very basic instrument. We have never seen a power instrument. It's only chisel, hammer, gouge, and very basic instruments. Very basic part of it. So our professor of medicine, he used to always say, I think if my children they become doctors, if they are intelligent, I'll put them into medicine. If they are average, I will put them into surgery. If they are idiotic, I'll put them in orthopedics. So I mean that was the way it is. With all due respect for current orthopedic, I'm speaking about uh, I mean the concepts
okay.
because the facilities, the instrumentation was very basic. It
Yeah.
was still not very well developed, at least in our country, in the place where we are. So that was my true calling for orthopedics, and I think I owe a great. I'm indebted to Dr. K. Srinivasan, who is a very senior consultant orthopedic surgeon, who still practices now at Malleshwaram,
Oh, okay.
and he is my true inspiring teacher. because there is a saying, a bad teacher complains, a good teacher teaches, an average teacher teaches, a good teacher discusses, and an outstanding teacher inspires.
Wow.
For me, he was an outstanding teacher. He never spoke a word, but he inspired out of his workmanship. So that is the time I think mind was set that to become an orthopedic surgeon. 1988 was the time when things changed. Things they do change,
Yeah.
many times for good. So that is the time when Supreme Court gave an order that 25% of the postgraduate seats should be reserved for central quota. And
Okay.
that is the time they conducted the first All India medical entrance examination for postgraduate admission. So I got into MS Orthopedics at KMC Hubli. That was in 1988, and from 88 to 91, we had an option to take up Diplomat National Board at the same time. So I cleared my part 1 in 1989, and 1991 I completed both my MS Orthopedics as well as Diplomat National Board. I mean, that is the way I think probably I can say.
So by hearing your journey, right, I have another two questions because it has triggered. So today, there are a lot of people, not only those who are aspiring doctors. So though they are getting into different profession, it could be any profession for that matter. Right, today they had to relocate from one place to another place when we have relocated, right? Because since you have done your primary and secondary education in Malnad, right, where the language could be an issue when you get into MBBS. Maybe when I say conversing in English, that
Definitely is.
right, and getting adjusted for the food culture, it could be right. The focus more in terms of when you relocated to different place, right, could be your hostel, could be your food, the food you eat or the facility which you get when you interact with other people, especially today metropolitan city or any cities for that matter. English has become a universal language where people will talk in English, right? So did you face any kind of those language barrier issues, or maybe in terms of have you faced any issues among your food, or so how was your hostel days?
Good question. You are good in grammatical English. You could write good English. We can probably speak to that point. But a regular speech, talking to conversing in English the way probably we are speaking, no, you are not, because we spoke in Kannada practically with everybody. I continued to do the same thing when I was there, even in Bangalore Medical College to begin with.
Okay.
Because see, ultimately, language is basically what is the purpose of a language? It is only to make sure that we communicate with each other.
Exactly.
Correct? Birds they do in a different way. Animals they do it with the thing. Wolves they do by howling. Dogs they do by barking. At least we speak different languages.
Yeah.
I think language is only for communication. So long as we know that part of it, I think they're all. We never had a problem with the language part of it. Never felt inferior that I didn't know English. See, that is the most important part.
Exactly.
Of it. See, many people they think that, oh, I don't know this language. Oh, how can I can manage? See, it is just like this. A person who speaks doesn't mean that he should have know all the things. Yes, person probably speaks loud doesn't mean that he should be completely right.
Yeah.
When you are young, you are very, very adaptable.
Yeah.
You can adapt to any type of food, and you can probably sleep anywhere. You can do the thing. That is what you call as adaptability, and where you can probably sustaining capacity is far, far better when you are probably younger.
Today, why I have asked this question, because there are many people outside, right, who are upcoming doctors. They are starting their careers, and then not only in terms of the doctor profession as such, any other professionals. Today, there are a lot of people would be traveling or relocating from the different part of the city, right, where they are focusing more in terms of stay. So I have heard people where the PG which I am staying is not good, the food is not good, right, and then they do have a problem where they are working, right, and then the focus is more in terms of the food, or maybe the shelter, or maybe the PG, they started cribbing about these are the facilities. Basically, somebody wants to become successful. This is the path where, as you have mentioned, you have accepted. So where people have, and then some of them will have inferiority, some of them will have adjustment issues. This has become a very big issue now. The professionals, basically, or the students, or those who are starting their career and they're relocating to Bangalore, I have heard many, and then we have counseled many silly reasons at times. They say, when we do the counseling, they say, today in the PG I did not get the dal. What should I do? This is a biggest concern, because that particular person is here to start his career, achieve something in life, to become successful, but where they are concentrating more in terms of the facility, other facility as such. So this is a very good message, and then you had discussed today. This triggered me another question, because you had mentioned you have done 8,000 surgeries. So to imagine, it takes time for me.
There are plenty
So
of
to
people
do
who have
this.
done much bigger than much bigger numbers.
But even for
And
me,
conservative number, yeah.
8,000 surgeries is not a small number. So even though it is 30 years, that out of 30 years, 3 decades of an experience. Ideally, someone who says, the moment when we are going to a doctor, right, always we will have some kind of, okay, the report should come negative. So some of the thoughts, ideally, right, and then maybe they have a pain. If they want to go to doctor, get consulted, and they will have some kind of panic situation, right? How do you counsel them, right? They will have lot of questions, and then initial assessment which you do, the diagnosis happens, and the followed by the MRI scan, it could be. So ideally, when you have a patient, so how do you manage them? So how do you answer those questions to all of them?
That's a very, it's a very nice question. I always say there are four things, at least I have noticed in my practice, which I did, which I continue to do even today. First thing is, you are in a service industry. A waiter who serves is also a servant. A security guard who probably gets up and say Namaste sir, he is also a servant. Even a doctor is also a servant, because basically it is a service provider.
Yeah.
So basic first thing what is required for a servant is loyalty, honesty, humility, and modesty. I probably repeat: loyalty, honesty, humility, and modesty. So you need to probably keep those things which are active, and which once you start with this, everything becomes clear. Fog is clear, no confusion. First thing is, think like a patient. I always think like a patient. Thinking like a patient is the first important thing. That is the beginning. It is just like trying to know the language, trying to know the words. Then you can make sentences. It is like knowing the alphabet. An young patient who probably walks in, he has got a problem. So his intention is to become completely pain-free, to engage in the sports or whatever he's trying to do, that part of it. For him, it is 100% fitness and to get better. And there's something like a time frame which is involved. A person probably who is a bit elderly, for him is mobility, pain-free life, and to be independent. A person probably very elderly person, he wants to be doing things by himself and not to be dependent on somebody else. And that is the first part of it. They want to get better. They want to be pain-free. The second thing is that, as far as possible, if things can be taken care without any body invasion, surgery or any surgical intervention, that is most welcome. If I am a patient, if somebody says that I can give a better result or I can give the equivalent result without operating on you, I said, okay, boss, doctor, go ahead and do it. So that is the second part of it. Third thing is, if at all a surgery needs to be done, it should be done in the best possible way with the outcomes almost guaranteed. I don't use the word guaranteed, but they want a sort of guarantee. They don't use the word guarantee. And In case if something goes wrong, are you there still for them to take care further? Or you want to disown them? This is the fear. And of course, the other part of it, the financial part is always there. For me, in my practice, that never played a role because people who come to me are reasonably affordable. At the time when people could not afford, I made sure that at least my services were affordable to them, finding one or the other way, because we have got a trust which sometimes funds some of the expenses. And I can always write off the professional charges. So coming back to the same question, thinking like a patient is very important, because once you know what they want, you are trying to live inside them and trying to know the part of it. He's trying to know the patient. And that is the time, though I sit on my side and the patient sits across the table, I always say, though I am across the table, I am always by your side.
Okay.
That is very important. I always say, if I can treat a patient without a surgery with an equivalent result, I don't operate him at all. You don't need to raise a finger. You don't need to move a finger, but you can get the same amount of result. Go ahead and do it.
Yeah.
It is like sitting on a good investment without churning them, without attending to them. It compounds. There is a time when you need to probably do a surgery where it is really essential. You need to be good at whatever you do. In the beginning phase of my career, I did take some advices from people who are good at that part of it. But subsequently, I reached a stage where I think had to do that by myself. And of course, you've got plenty of channels which are available. You've got PubMed, you've got plenty of educational videos are there. And you attend conferences to educate ourselves to improve on that part of it. So, that is the other part of it.
Uh, Now, when we talk about surgery, right? I mean, as you said, you go with four principle. That's the success behind your 8,000 plus surgery, right? Talking to 8,000 different people, and then basically explaining what they are going through, and then understand their situation, and then more of just like a parent that you counsel. So we do have a concept. Called ideally pre-surgery counseling, they do it. In Western countries, are they following this pre-surgery counseling? How does it work?
Yeah, I think in the West, they have got what you call, in UK when we were there, they used to have what you call as a hip club, they used to have knee club. So, joint replacement is one of the commonest surgeries done in the West, especially in UK where we were there. So, the hip club or the knee club is a gathering where there are people who have undergone surgeries many years earlier, what probably call them as veterans.
Okay.
They address the people. And there are people who have undergone surgeries few weeks later, few months later, and few years later. And it will be attended by people who are likely to undergo surgery.
Yes, just to summarize, ideally, it is kind of you will make the patient take decisions, not pushing them.
Perfect.
Right? Where you will enable them with more information what they are going through and what is the outcome they should expect out of the surgery.
Got it.
And maybe the sum of the complication is definitely any surgery for that matter, it will have pros and cons, right? Especially when we are talking about the knee surgery. Knee surgery, there will be a suffering time initially, a couple of months.
Correct.
This is something they have to go through.
Okay.
And then this is a very beautiful concept which you have explained, where in UK they get to see people, those who have undergone surgery, they will have, ideally have an opportunity to discuss. They discuss live, and then they discuss their problems. They discuss because since in UK, in Western countries, what happens, they are open. The counseling concept is more accepted right from the childhood or maybe the grassroots, I would say. So this is something somebody, those who are watching this, ideally, this podcast, if you have a problem, if you have come across any kind of situations, right, if you express and talk to other people, right, that's a very good information, right? And we can control a lot of mistakes too. So this is pre-counseling concept, and I would like to discuss about maybe I know, can I ask this question?
Because please do.
Right, So, since you said you have a principle where you follow, and then there is an ethics, and then you follow that, there is a principle of four principle where you do counseling. And initially, you also mentioned you got trained where without, say, for example, if it is true surgery cases, and then you will persevere. Otherwise, you will not. And then I have heard from a lot of people, they say, second opinion, yes, let me consult Dr. Jairam. That's what I have heard. Because he is the one, he says he will not do the surgery just because of to meet the target. I'm actually using this word. Sorry for that. This is and this hospitals and everything has been corporate. I mean, it has become a corporate industry now. Right? People talk about lot of today. The we have to meet the target. Right? What do you want to comment on this? I mean, is it really true? Where people say, okay, they to meet the target, they are doing the surgeries.
Prasanna, it is a very delicate concept.
Yeah, yeah.
For me, the thing is that everything worked out well. The first patient I operated in my practice in 1991 was a 93-year-old lady for a hip fracture where we had to organize a fracture table, we had to organize a portable X-ray, we did the surgery. I remember her name is Papatiyamma.
Okay.
The lady survived up to the age of 97. I treated her son, daughter-in-law, her grandson, and a great-grandson. I have treated fourth generation of those patients, even till recently. So, since the financial part of it, for me, it is a success story. So, I kept my part of my commitment. Patients kept their part of the commitment. There are no person probably has defaulted on the payments to me any point of time. Nobody has ever asked, why doctor your fees is so much? Why are you charging that? No. They might probably ask, can you help me out in your charges? Apart from that, the patient has been fantastic. But for me, it is a different situation altogether. If you work as a professional true to that particular type of commitment, you don't bring the business into this part of it. Whatever I told you in the first, think like a patient, act like a surgeon, be like a parent, and be a trustee of actions. So in this formula, the business never comes anywhere there.
Exactly. This triggered me another question because we spoke about surgery, pre-surgery counseling. Uh, in India, so basically every year, the rate of surgery or the stat says, so it's going on a high scale. The percentage is growing. What could be the reason? And maybe after the surgery, the care. So post surgery rehab we talk about. So there are people I have seen where they got the surgery done, and after surgery they are not taking care of things well. So in case if they are not doing it, what happens? So ideally, the post surgery rehab we call about.
See, it is like this. I have seen this. I have seen three phases in my career where some facilities like joint replacement at the time when we started was not available. It was like for ultra luxurious people, and somebody got a joint replacement, like a heart operation. They used to go to US and they had to get back. They used to get the surgery, then used to come back. So it was not available, technical, and basically the things were all not defined, and if there were complications, people were uncertain. But over a period of time, the primary surgeons, if they go wrong, what we call as revision, the redo surgeries. So when we do the first surgery, we post, for example, first knee replacement, then you do again, we call it as a first revision. And if that goes wrong, you can do a second revision. In hip replacement, the surgeons probably, they have gone right up to sixth, seventh revisions. I myself have done up to the fifth revision in the hip, and I have done up to fourth revision in the knee. That is the redo surgeries, because those type of implants are available, those type of facilities are available, and there are modular implants, there are custom made implants, there are other augments which are all available. So over a period of time, science has grown, and it has become very vast. So it has become very versatile. Surgeries have become versatile, and people's acceptance of something can go wrong, that also has improved. Now coming to the very other question, first question you asked about number of surgeries are increasing. When the facilities are not much, you can't expect
Yeah.
number to go up. When you look at the number of hospitals, which has been surfacing, more number of hospitals, how many surgeons used to come out, how many surgeons are coming out now, population also has gone. Maybe the population would have, world population probably would have doubled
Yeah.
from
Yeah. Yeah.
1970 onwards. But the facilities have outpaced the population growth. Affordability of people has improved. You look at most of the people, they have affordability. There's something called a saving. And insurance sector, the penetration has been also much deeper. A lot of people, they take the insurance. They've got health cover. So that being taken care. So improved facilities, improved expertise, more number of hospitals, improved economic status of people, and the availability of insurance, and there's something called as Google, internet, where people can exchange ideas,
Yeah.
and people, they go through that, they have a discussion, they're aware of things, they're aware of the facilities, etc., etc. So all these things probably had made the people to say, fine, why not take my chance?
Okay.
So I think that's all probably I can say. So when you probably look at as a business, maybe I think it was definitely lacking. But if you look at as a professional excellence and personal satisfaction, I'm contented, I'm happy. Ultimately, every person, Prasanna, that is a very important thing. I probably reiterate at this point of time is, what is every person's responsibility? Every person has a responsibility for himself. And his first responsibility is to remain happy. And happiness is an eternal process. It comes in small installment. It's a quantum theory of mechanics. Probably you say it comes in small quantums. So it comes in small quantities. For me, it comes with probably every patient I treat and every result probably I see. So, but it accumulates. It accumulates over a period of time. When you have probably numbers and you look at the money part of it, that is pleasure. Pleasure is addictive. It is like sugar. It is like sweets. It is like chocolates. Eat one, it stays very tasty, but you need to probably eat keeping. So we need to probably cut that on our desire on chasing somebody's number,
True.
chasing somebody's wealth, and it is a competition. Now, I always feel life is sort of a competition. It is a solo run.
Yeah.
It is a run which you are trying to do that part of it. See, there are times plain ground is there, you can run faster. There are times where probably it is uphill, you need to go slow. But all important part of in our journey, life's journey is first choose the direction you want to travel. I chose the direction I wanted to travel a long time back, 1979 when I wanted to be a doctor, 1988 to become an orthopedic surgeon, and 1999 to return back to India to pay my debt because I am indebted to this country because I was born here, my mother was here, the government paid the scholarship, and I've been grown into a particular position like that. I train. So I think I need to probably give back to my country, to my society, and to my people over here. Otherwise, at the time when every person dies, like one thing is sure, a person is born is always going to die.
So, since you have done 8,000 surgeries so far, so also I have heard you have done surgery for a lot of athletes, right? And even for geriatric people, you have done a lot of surgeries. So, out of this 8,000 surgery, if I ask you, which surgery where you have completed, right, that you never forget that this is something I have done? So do you have any such scenarios or a story out of this 8,000 plus surgeries?
I got, I can probably sit the entire day and probably speak about those number of surgeries. I can probably give you a good number of examples. Very recently, I saw a girl, probably in adulthood. She just came for some foot problem and they appeared familiar to me. The mother appeared familiar to me, and at the time when I was examining, then she told, Doctor, sir, She is my daughter whom we have treated for a clubfoot deformity during her childhood. I had operated her
Okay.
for a foot deformity, and I could recognize that except for the scar which was there, but she was walking normally, and I felt good about it. That's one part of it. And there was a lady where she had never moved out of the house because of an arthritic knee, etc. And probably she had lost all the hopes. When on my return, they came and saw me, and I had to just tell her that knee replacement will help. And it is both knee replacements were successful, and now she is 80, past 80. Her daughter is also a doctor. She is an ophthalmologist. And now she is still about 23, 24 years now, post knee replacement. Still, she is walking around. There was a young chap who had a renal rickets where the leg had become deformed. It was what you call the valgus knee, knock knee. And he had a lot of difficulty in walking. So we did a sort of a unique procedure we call as a high tibial osteotomy. We call it the dial osteotomy, which is not regularly done. We do what is a opening wedge or a closing wedge osteotomy. It is like a dial where you can correct the rotation, you can correct the angular deformity, etc. This boy now, he attends the gym. He is like a pocket Hercules. He walks quite normally. A 16-year-old national level swimmer who was brought to me by her coach, and she had a shoulder problem, and she was I think she was a specialist in butterfly, if I remember, and I think she was holding a record for 50 meters butterfly at the point of time, and she had a shoulder problem. Like swimmers, bowlers, they have a condition what you call as rotator cuff impingement.
Rotator cuff, yes.
So I had a rotator cuff impingement. When I had a look at the shoulder, I said that you have a cuff impingement and probably cuff was not torn. So we did a keyhole surgery, what arthroscopic subacromial decompression. We made 2 small ports, we tried to smoothen out the bone, and we cleared the space, and then surgery went off very well. I tell you, Prasanna, 3 weeks later, this girl was in the pool training. 5 months down the line, she came to me with her father. Her father and mother were very, very supportive.
Okay.
I mean, I cannot take the names here because it is a podcast. Very, very supportive. Especially his father used to probably take her for training, etc., etc. Because I think for sports people, especially the parents should be very, very dedicated. So I think they had the dedication, both her mother and father. And he came with her father with 5 gold medals around her neck because she won 5 golds in South Asian Federation Games.
Okay.
She went on to win about 38 medals overall in international competitions. And the crowning glory, that moment of glory was when she participated in the World Aquatic Competition, World Swimming Competition in Rome. She could see Michael Phelps. And in 2010, I think she got an Eklavya award also. At the same time, I had treated another shoulder arthroscopy patient. She was also a tennis player and she also got the Eklavya award. I think that is the way. The trust probably I enjoy from my patients. I think I owe a great deal to them. I had to do just whatever I was supposed to do. I think there is a very basic thing which is expected out of me. Yeah. And after so many years of time, I have not done anything extraordinary.
So ideally, these two scenarios, I mean, these two patient stories which you have expressed. So a girl who is 16 years old, she had to undergo, the rotator cuff injury, rotator cuff surgery. Ideally, for any athlete for that matter, injury is a shock. So ideally,
yes,
because they'll have to go through a very difficult time. The moment, until yesterday, they had a different routine. All of a sudden, they had to stop. So as you also mentioned, if any athlete who is performing, it is a family effort. Because even I do have my son, he is also getting trained and he's also a tennis player where he started his professional tennis. It's a huge effort towards an athlete. So parents, definitely they have to put in efforts. Every day they need to take their kids for training and then for the competition, good nutrition aspect, and then they have to protect them from injury. So since till today, it's been almost close to 20 years if I say so, or 15 years, right? So after the surgery, she has accomplished So what I could see is, because surgery is one part where you have performed, and then you also mentioned about where I know the parental ideally support, right?
Right? Correct.
And then definitely a psychological support. There won't be any pressure as such, or maybe a psychologist, or the sports psychologist, and then nutrition. Definitely, I mean, even the nutrition plays a major role for the speedy recovery, and even rehab, right? Since you also mentioned about a 68 years lady where she could recover soon, and then she has performed some of the exercises where maybe today after the surgery a proper physiotherapy, and then the counseling support as such, where, because even though the pre-counseling which you do it, and the post surgery counseling you do it, so that is a 3 months of efforts where they have to undergo, where the counseling would also plays a major role, where even for the doctors, you might have received a couple of calls, right? Even any patient for that matter, today I am not getting sleep, or maybe,
I get plenty of calls.
yes, I am not getting sleep, what
I
should I
got
do?
calls even at 1:30 saying that, doctor, I am not getting sleep.
Yes.
So, but I am sleeping, man. So call me tomorrow.
So these are the, so the post surgery ideally the support. So now it's AI era. People are talking about AI, and then even for the surgery, robotics have been introduced. And then where people say, okay, even for basically colon surgery, they do, and then any surgery for that matter, the robotics have been introduced. And also in the internet, people are talking about AI would replace doctors. So, what is your take out of this? The statement. So, is it really true? Where down the line, next 10 years or 15 years or 20 years, maybe 2 decades after that, is it really going to happen? Because the way we have grown, where we interact with people, right? And then if you ask me, talking to any machine will not give any comfort for us. But when we discuss with any Gen Z's now, these generation kids, they say talking to a machine is much easier than the talking to human. So at times it surprises us, at times it scares us, because they say, I asked a 18-year-old guy, right? I asked him, why are you liking this concept, or why do you want to talk to a machine? He said, it will not judge me at all. I can talk whatever I want. If I am conversing with any human being, he will judge. So these are the some concepts today, which is actually running in social media or in internet, I would say. So, what is your take between AI, and then is there any huge impact in terms of doctors or doctor profession?
See, I am a surgeon with some degree of understanding of AI. I think this is something which is going to basically what exactly is artificial intelligence. It is basically it is about data. You have a sort of a program or where you give the data with an input and say it is just like you put a CT scan with a lesion in the lung and you put similar type of pictures and ultimately say there is a nodule in this portion of the lung which appears dense, looks like a cancerous lesion. You feed in some type of such particular data, 10, 20, 30, 40, any of those numbers, something similar to that, different sizes. Ultimately, over a period of time, then when you ask AI and they say what exactly is this, it says it looks like tumor. So this is machine learning. So the training of AI, the data creation and whatever you need to do, that part of it is data driven. But who provides the data? That is very important. See, data is provided by a lot of people. And there are times when at the particular lesion, whatever you think, it can be tumorous, it can be infective. I just tell you I will tell you a live incident. I had somebody whom I very close to me. He was not feeling very well. It was the post-COVID era. He had a little bit of cough, and I saw him once 3 4 weeks later, and he appeared completely uh, weak and completely drowned. White, black rings around the eyes. He appeared completely drained out. Then I asked him what is happening. He said a little bit of fever and no appetite and cough. When he got the blood test done, his hemoglobin was low and CRP was high, ESR was high. Then I thought it is not allergic. He was being treated for as allergic bronchitis or some sort of an infection. Then I said, no, I think only these things can happen in two conditions. One is a miliary tuberculosis or it can be a lung cancer. So we got all the investigations done. He was referred to a physician. He thought that it can be a case of miliary tuberculosis, but it never turned out to be. So they had to do what you call the procedure called EBUS, that is a transbronchial transesophageal biopsy, which is ultrasound guided. That came as undifferentiated lung cancer. From the time of diagnosis, he only lived up to about 8 months and he passed away. So the lesion, it was very small, like a nodule in the lingular lobe. And there were lymph nodes in the hilar nodes. So a similar type of lesion can have, there are 3 4 type of conditions where they can mimic the same. So it the data which is being given to the AI, if it probably is being said, if it says tuberculosis, then probably it repeats tuberculosis. If you probably say this, etc. So it is only a rough example. I may not be completely, I'm trying to give a message here is, it learns from its teachers. Machine learning, it's data driven. And data may change. It depends on who feeds the data. So there, I think to go by purely on AI driven diagnosis, I think that is going to be dangerous.
Okay.
But there are times when a radiologist has to go through 50 X-rays, 60 X-rays because of his, maybe he is tired, maybe he is not concentrating, maybe he gets a call. There are times when something can be missed out. So at that point of time, when these things, they go through AI, and AI is never going to get tired.
Yeah.
It is going to be steadfast in doing things. It is like a robotic device where they are expected to do that particular job, they will do that job. So they are unemotional, they are attentive, and they are predictable.
Yeah.
And the question, the data which is given. But the result, whatever the result you derive out of the AI, it is data driven.
Okay.
The data is perfect, that's fine. And data keeps changing. Like the principles, they keep changing. We say that is the truth. You look at the time when, a long time back, at the time of Galileo, people, they thought that the sun was moving around, revolving around the earth, and he said no, and he was punished almost with a death sentence.
True.
And ultimately it was proved later by, I think it was Lord Kepler, who probably said that it is the other way around. So if time and again it has been proved that what we think was our truth, it changes over a period of time. So unless the data which is being given, it is constantly being monitored, it should be from highly trained people who have been very good at this, and it is multimodal, then I think you can expect. It is more like a vigilance. It is like some reports, they go through the AI, it can probably give its opinion, but that should be definitely supervised or being looked at by a human, a doctor, then he can probably take a conclusion. It's just like saying there is a fracture which may probably, I saw an elderly man with a fracture where it was minimally displaced. It may get displaced, may not get displaced. So I did treat it and it did unite. If it displaced, I would have probably decided to operate. So human mind has so much imagination. Ultimately, you should remember who designed the AI, who came out with the AI. It is the human mind. So you can't probably completely surrender your entire authority to AI and they say, I stop thinking. Now, I think that is going to be, you are just going back to Stone Age now. So we need to probably keep, but change is the order of the day. You can't stop the change. You need to accept the change. It's just like there are two professionals, whether it's an engineer or a doctor, whoever it is, he is good in job. If he knows AI, he can probably retain the job. He is good, but he doesn't know AI. Probably he may lose the job when it comes to question of choices between the two. People probably will choose, or a industry may choose an engineer with an AI knowledge than an engineer who is good but he doesn't have an AI knowledge. So it is just like changes they happen. If you don't progress with the change, then the things will punish. It's just like what happened to Kodak, what happened to Polaroid, and what happened to Xerox, what happened to Yahoo.
Nokia.
Yeah, they could not. Nokia is the best example.
Exactly.
Motorola, Nokia were the first ones to come out with mobile phones, but they didn't change over to touch phones. They just lost their advantage. But so I mean that is the way it is. But medicine is something totally different. Same thing if probably I say they have a role to play. They will evolve over a period of time. You can't just discount them. You need to be aware. But I think you should be aware and you should only use with discretion. I say be aware, use with discretion. That is the word probably I say. Now when it comes to question of orthopedic surgery. Now we use robotic arm for hip replacement, knee replacement, etc. etc. Now the limitation here is every company has got a robotic device. It will cost probably about few crores.
Okay.
Annual maintenance will cost about 80-85 lakhs. And you've got what you call the reusable, what you call the disposable pins, which people they try to reuse. So when the process goes like this, if I have to do your knee replacement, I will take a CT scan of your knee. I will put that, I will process those images, and the computer will come out with your knee alignment, what is the native alignment to the thing, what called individualization. And it says probably these are the amount of bone to be cut at this particular angle, etc. Give those images. And when you take the patient to the OR, anesthetic, the same anesthetist, a surgeon only will make a cut, he will make the tissue releases. He uses the robotic arm when you have to do the bone cuts.
Okay.
After having done the bone cuts, then you put the implant. So robotic arm you use only to make the cuts.
Okay.
There are two things it will decide. Angle of the cut, sizing of the implant. Apart from that, tissue balancing to an extent, yes. Tissue balancing, what you call the flexion extension, gap managing. Now here, this is the way it is. Will it bring down the surgical time? I don't think so. Because you need to probably put tracker pins there, so extra expense. You need to do the CT scan, etc., etc. I always believe there is something like a linkage system. The CT and a computer gives the models, and that is fed, it comes out with the data, and then you use the arm. Any of these things, if there is a slightest error, it gets magnified.
Yeah.
The origin, if there is a slight error, it gets magnified because at the time when you try to do that part of it. Now we have got the mechanical instrumentation. Whatever I do is, I don't use robotic device when I do a replacement. We have got what I call the mechanical instrumentation. We have got well calibrated jigs where you can look into that. I also do individualization of the patients. And each time I probably do, I take my time. I take a decent 2.5 hours for a knee replacement and about a hip replacement. A revision maybe about 3.5, 4 hours. So, but I make sure that I look into the angles, I probably calculate, I superimpose one X-ray over other X-rays, I practically get that right every time I do, because I got the time on my side. If you can give time, you're not the one probably in a hurry. Then if you're like a sculptor, see for me, I probably put myself as a sculptor. The difference between a carpenter and a sculptor. These are the only concept. Probably people use robotic device, may disagree. That is a different thing. For me, I don't think should be a matter. But probably who are there in the younger who are starting their career, they need to probably keep a watch on that part of it because they've got a very long career to go. But one thing is sure that these are the things which are happening, they are going to be here. AI is going to stay, robotic devices are going to stay, but to completely replace the human judgment, that I think I got my own doubts. But humans cannot be replaced because you are managing with, you have to talk to a person, one person can probably understand and misunderstand a person better rather than probably an AI or a robotic device.
So, even nutshell, if I say so, the conclusion basically, You are saying so. It's a combination of human and the AI that has
Exactly.
to be.
Yeah, it will. It
Yes,
will.
that has to be
Over a period of time,
utilized.
yeah.
Utilized on a combination of human and along with where we have to use AI, right? So that will give a best result, and even robotics that can be
It is
used.
your native intelligence,
Yes.
and that is being polished with AI
Yeah.
help.
Yeah.
So
Yeah.
that probably you can just save on the time, and probably you can probably, it is just like having a great assistant who
Yeah.
can help you out and to do that part of it. And like a great specialist assistant
Yeah.
who can
Yeah.
help you out and probably you concentrate on doing things. But you are not going to replace. AI is not going to replace. But you need to have people.
So this triggered me another question. Basically, you do knee surgery and then you do hip replacement surgery.
I do hip replacement, knee
And then,
replacement, shoulder
yes,
replacement, elbow replacement,
what
revisions.
are the top reasons for this? Is it genetics, or maybe, let's say, can we prevent it, or if we need to prevent this, how do I prevent? It could be a knee replacement. It could be hip. At times, yes, I have heard hip replacement. It is because of somebody fell down, and then during their geriatric cases, it happens, and then during accidents, yes, it happens. But in terms of knee surgery, so is there any prevention as such?
Yes. Now, when you asked me about hip, what you do a partial hip replacement, etc., in the elderly care, it is mainly because of hip fractures when they come. That is called a partial hip replacement called as bipolar hemiarthroplasty. Total hip replacements we do for, in our condition, what do you say, for avascular necrosis, where the femoral head loses the blood supply. Post-COVID, we saw a lot of patients who were on steroid for high doses. The ball lost the blood supply, it started collapsing, so we had to do cold decompression or we had to do a hip replacement. The ball collapses, it loses the shape, it becomes, that is the one. The second thing is arthritic conditions. It can be like ankylosing spondylitis, rheumatoid arthritis, one of these autoimmune diseases where it can cause hip arthritis. Injuries, like people probably would have femoral head fracture or a intertrochanteric fracture which malunited, or it can be central fracture dislocations where probably it caused to that part of it. There's a condition called as primary osteoarthritis of the hip, which is not very common here, but it is very common in the Western race. So coming to the knee, 70% or 75% of the patients I operate for knee replacements are women.
Okay. Yeah.
Now, when it comes to bring in my question, my mother always has to ask the question, how many surgeries today? Both knees, she used to say, she had done the word bilateral or single. I said sometimes bilateral, man or woman. And most of the time my answer used to be always women. He said, why only women they have to go through that? Occasionally, she never used to ask the question. I say, you didn't ask me today. Why? Today was a man. Oh, at least. Occasionally. So it's almost like 75 to, I play 70 to 30 is the ratio. Mainly because there are two things is habits. Women, they are more, I am speaking about the previous, now that the things are, demography and practice are changing. They sit cross-legged, they kneel, they squat, they do all these habits where they probably load the knee too much.
Okay.
Generally, they have got more laxity of the ligament, and because the estrogenic influence, the ligaments can stretch out. Third thing is a more prone for osteoporosis, where probably to tend to weaken the bone.
Okay.
The greatest danger here is pain tolerance. Women, they have got a very high pain tolerance compared to men. You have a headache, you should complaining, you say you don't do any work, you take and ask your wife, come on, get me a cup of coffee and I am so tired and come sit with me and blah, blah, blah. But women, no. Their pain tolerance is so high, so small aches and pains, they continue to do that part of it. So they cannot probably give the sort of an attention they need to do because there are a lot of things which are on their plate. Taking care of the family, that, these, etc. They give the least amount of attention to their pains. So that probably allows them to prolong this for a period of time.
Okay.
So I think probably I can say it is a combination of their habits, and the muscle tone becomes less, osteoporosis, plus hypointolerance, all these things probably they attribute to higher occurrence of knee osteoarthritis and greater amount of deformity. Of course, nutrition deficiency, I told you, like vitamin
Yes,
D and
nutrition
calcium.
deficiency.
And the thing is obesity.
Okay.
Obesity is a killer. Doesn't mean that people who are thin, they don't have knee problems. They do have.
Okay.
That is one part of it. And pre-existing alignment problems in the knee. Some people, they have got what you call as knock knee. Some of them, they have got what you call as bow legs. Bow legs and knock knees are associated if they are not attended to at early stage.
Yeah.
So I do a procedure called as biological reconstruction. When you identify a patient with early osteoarthritis, when the knee is deformed, we make a cut in the leg bone, tibia. We try to open up the wedge where you try to realign the leg. And this you need to do before the wear and tear process goes beyond a particular limit. So where the things can reverse or things become stagnant. The only issue is that if you know that there is something wrong, there's something wrong. But go to a doctor, have a clear understanding of what exactly is happening. Before you go, try to find out whom you are going.
Yeah.
That is very important.
Okay, I mean, reaching to the right person is very important, because, as you said, the prevention can be some of the, so consciously they have to avoid, and then there is another, another thing we have got it today, where where you have done the surgery, most of them are women, basically a knee replacement.
Yeah, correct. That's true.
That is one point which we had a discussion, and so we also know about osteoporosis. You spoke about. Ideally, this DEXA scan, right? Usually,
yes.
where yes. People say if they get bone density, because the data says
Yes.
if I do a check for 10, randomly if I do a check of 10, out of which 4 will have a problem.
Yes.
So when we do a DEXA scan or a quick scan with the help of radiation, ideally they do it. Would that help, or maybe out of which during the time, if they can work on the nutrition part, so would that?
See, it's a DEXA scan. I think women during the perimenopausal age, at the time when the menstrual cycle comes to a halt, around that time, probably say in their 48, 50, or maybe 45, 46, even in the early menopause, that is the time people they have to have an assessment done about our vitamin D, vitamin B12 levels, nutritional levels, plus their DEXA scan. Men, probably they just go, unless they don't have any problem, like they are on steroids or immunosuppressants, or probably they have got another collagen disorders, or probably renal disorders, renal failure, etc. There is no comorbid condition, they usually pretty well. So women, particularly those who undergo hysterectomy, or people who have early menopause, or during perimenopausal age group, they should get a DEXA scan to know what is their status of both. Taking randomly a calcium vitamin D is not going to help.
Yeah,
There is no random. There is nothing like random here.
Unless and until,
Correct.
yes, because that's why I said if we do the check at the initial stage, right, we can prevent. And then this triggered me another question. So because ACL surgery,
Yes.
right, that's a quite common. There are a lot of, and then some of the sports are injury prone, especially when we talk about footballers. So footballers and the cricketers, and then basically any, including badminton, any racket sports as well. So they do come up with this ACL tear. So is it something can be preventable, or is it something they can't prevent at all? So the reason, because when we deal with, when we are talking with any sports academies, right, especially when I'm talking about footballers, right, they come up with these issues, ACL tear. And even for that matter, now recreational players also will have this ACL. It is shocking at times when we talk about some other well-being services. They say, okay, I had a ACL tear, just like that. Okay, this is my second surgery, I'm going. Right. So ACL tear, can we prevent that, or if we need to prevent, what are the key things they should follow?
See, it is like this. Sports injuries, you can never say that it can be prevented. It is just like predicting future. So it is like there are high contact sports. You are running, you are trying to take the weight on that leg, or you are kicking, somebody tackles you, you completely roll over, you stretch the ligament tears. So any contact sports, the possibility of an sports injury like an ACL tear or it may be a PCL tear or it may be meniscal injury, you can't completely avoid that. Prevention. Now, a person probably who does a good pre-sports warm-up, who has a protective gear and positions himself the way he plays, I think it is just like what you call as, it is like safe driving.
That means you are
Correct.
saying strength and conditioning
Strength and conditioning.
and
But
properly
when you,
warm up and
I mean,
cool
that is
down.
about regular persons.
Yeah.
When you probably have a Formula One racing, how many times, though Formula One racing has probably the highest speed, how many Formula One racing accident you see? It may be Niki Lauda somewhere in 1974,
Yeah.
or it can be Ayrton Senna probably who had an accident, who probably died that way. No, but still these competitions, they happen, but they are done in ideal conditions. There is another other type of traffic which is there. They monitor their tire pressures, they have everything which is there, they know whether everything is the revolutions, etc., etc. And the switch gears, whatever, they are made up of zirconium. They are all, they drive a machine which can withstand that amount of force and they have got the skills. So it is about a man and the machine. Here also, at the time when a person, he should condition his body in such a way, the muscles are perfectly all right, and his body weight is ideal, and he has to have the right way of making motions, he has the way of making moves and positioning. So injury prevention is, it is a sort of a skill. It is just like you probably see Messi how he makes his way. You saw Diego Maradona how he used to probably dodge
Yes.
6-7 defenders. He used to probably score a goal like that.
Yeah.
So they didn't probably suffer that type of injuries. Why? They could. You take something head on. That is the time when probably they can probably do that part of it. But if you ask me the plain question, is it completely preventable? No, it is not preventable. But once you have an injury, once the knee tends to swell up, when somebody has an injury, when they get up, the knee cannot support, or the knee swells up, the knee is painful. You got to go to the doctor, get the knee MRI'd. X-ray is not going to help.
Yeah.
And all patients, ACL is to be reconstructed. But there are times when probably you do an ACL reconstruction. I keep seeing some of the knees where they have an ACL tear. I look at the knee they have got a bow leg. The bow leg has to be corrected before you do that part of it. Then I have a tibial slope which can be slightly more, you need to correct that part of it. Then somebody do an ACL reconstruction, they take a meniscus out. Now you have to repair the meniscus. You need to address it holistically, you need to do that completely, and it should be done in a perfect way. There is nothing like part-time solutions for that.
So ideally, you are saying so even ACL prevention basically for an athlete it could
You
be
can't
any.
avoid it,
You
but
can't avoid
it.
but ideally follow with warm up, cool down, strengthening, right?
And the way probably
And then-
you play the sports,
yes,
etc., you need to find a device, a way of doing it.
Yeah.
Contact sports like contact kumite or probably martial arts, etc., kickboxing.
Yeah.
How can you avoid that? They need to take that weight, and it depends on it is like a last man standing.
Yes, and then even for that strength and conditioning, basically, if they condition
Strength,
the body,
conditioning, training, nutrition, and awareness. I think it's all to do with everything. It is
Yeah.
again the 3 or 4 pronged strategy. One is people they should be aware that they have got an ACL, they have got a PCL, and how they function, etc. Not all things, but it is about a trainer probably need to do that. What are the injuries a person can? So that is the role of a trainer. And that fitness coach will probably take care of that part of it. Nutrition, dietitian, whoever it is, probably work with that. Usually, people or personal trainers they do a combination of these things.
yeah,
And of course, they have to have programs where they can improve on their reflexes, etc. It is about the reflexes. How quickly you can probably people sometimes they jump, they catch the ball, and they roll over. I cannot do it. I'm sure that you cannot do it, but
Yeah.
they do it. Why? They've been trained to do that part of it.
exactly.
So
And-
injury prevention is an art, but some they are very resilient. Some are injury prone.
So ideally, as you have mentioned, any athlete for that matter, physiotherapy and then even their psychology and the nutrition part, strength and conditioning. Basically, if they have a proper strength and conditioning, they can also prevent injury where they can train
Yes.
and then condition their body,
Correct.
and then with the proper nutrition support as well. It has to be a team support again. And
Yeah,
in
it's
case
the
of an
team.
injury,
If I had to probably say
yes.
it's the team approach.
Yes, and of course, because there is a myth, people say these are the facilities only for those who are achieving at the national level, international level, at the state level. Because always I hear from parents says, why this is well-being. At times when we talk about well-being services, so they say these are the services which is not for my kid, because my kid is only 6 years old, right? So for those people who are watching, basically,
May I stop at this level now?
yes, please.
It is just trying to say only healthy people should leave. Only a rich man can enter. Only people are educated can have this facility. You are doing a sort of a discrimination where it is not right. No
Yeah,
discrimination is acceptable now.
yeah,
It should be available for. It is like this now. People they take term insurance, they take life insurance. Why? They anticipate death, they anticipate injury, they are likely to fall sick. But why can't you pay a premium to a health club or a facility where they provide you fitness services, they provide you dietitian services, they tell you what suits your body and what you can do for yourself? You spend some time for that, at least you remain fit. Whatever you are trying to do now, you need to probably keep doing it for a longer period of time. It applies to me too, because I never concentrated on that part of it. I am very seriously thinking of working on those part now, because till now it never bothered me. And because now I am in the best of my practice now, and it is still booming and still getting better.
yeah.
I'm improving. So there is the time I think I need to keep doing things better, than I need to probably keep myself fit. I think fitness, to stay fit, to stay healthy, and that what you call a sound mind in a sound body,
Yeah,
that is
yeah.
going to be there. I think that is everybody's entitlement, and whether it is old, whether it is young, it is universal, and just appears more for people and their 30s and 40s. See, I'll compare that to, I was just, I think this may not be related to that. I probably be comparison. See, I was going through a podcast by Professor Ashwath Damodaran. I think he's a professor of economics in one of the US universities. I don't know, Columbia or Walton or Princeton, one of the places. He speaks on valuation of the companies. The other day he was speaking about life cycle of a company. There's something like everything has got a life cycle.
Yeah.
What you call the startup,
Yeah.
get into a growing phase,
Yeah.
then it becomes a mature company and dying companies. The aspiration of a startup company is they have a single concept. They need to probably nurture the concept. They need to make sure that it's all done and brought to life, because if something is not being done. So, but if the market size which is available for this particular product is the only thing which will decide the future of the company.
Exactly.
Is there a market? Is the market size is big? And is the market going to expand? Is there a scope? That will, for him, he can probably make sure that they can burn their cash, they can spend, etc., but they should not sell their equity. You sell your equity, you're an entrepreneur and you sell your equity to somebody else, somebody sits on your head and probably say, you do this and this is what I want, because ultimately all the private equity investors, they want the money and they want to get out, but you have an idea to subserve. So they are very single about it. But a person who wants to probably grow, that is the time he needs to probably get people who have got the sort of monetary support. He needs to make it bigger. That's fine. But a company where it is mature, they need to keep doing the business in such a way that they need to reward their investors with the dividends and with bonuses, etc., etc. They need to survive. Unless they want to expand, they cannot behave like it. Like, say, I am 60 years plus, and I cannot behave like a teenager. Can I? I cannot behave like a teenager. You may feel like a teenager, but you can't
Yes.
behave like a teenager. So a mature company cannot behave like a growing company or like a startup.
Yeah.
Dying companies, they're different, because you don't want to speak. Nobody speaks of people, even a dying person doesn't want to accept that he is dying. Correct? He is still living.
Yeah.
The same philosophy applies over here.
True.
In youth, in young, growing phase, that is what is important, is for them to achieve and to stay fit for a long period of time. People who are mature, they need to probably stay for a longer period of time. People or mature companies, they need to make sure that so long as they leave, they need to be independent, they need to be fit, they should be able to enjoy what they want to do it, part of it.
Since you spoke about the insurance aspect, people will take term insurance as well, right? I always see illness always gets attention when we talk about wellness, and then you also have mentioned where we are okay to pay the premium for medical insurance, but we are not okay to pay any kind of the fees or for wellness services as such. So here there is a myth, and then people don't have any information about wellness. When we talk about wellness, people would think about, okay, wellness is something yoga, wellness is something ayurveda. So there are a lot of other services. So we talk about physiotherapy, after the surgery there will be a physiotherapy support definitely, and then the counseling support, right? The psychology, it comes under wellness, and including strength and conditioning. We talk about basically the injury prevention aspect, where even for an athlete, where they have to look at that they have to condition their body, strength training, strength and conditioning training they should undergo, and then proper warm up and the cool down they should be focusing on. And apart from that, the last but not the least, where the nutrition plays a major role. So where the nutrition aspect, when we are at the age of 30, right, ideally we will be focusing on more of the career aspect, and then when we are at the age of close to 40, we will think about maybe the medical insurance. I am covering my risk. So yes, definitely we are covering the risk, and even the term insurance, if something happened to any person for that matter who is a policy holder of term insurance, where the family is safe. So that is also a concept where we are thinking. But end of the day, if we look at, we are prepared for illness, not wellness. So what is actual, or maybe what is a real wealth? So being a doctor, right, what is a real wealth for you?
Great question. See, basically, let's dissect into the human nature. If somebody has been good to you 99 times, if that person is not favorable to you one time, you remember that one time more number of times than probably 99 times you have been good.
True.
I mean, just generally, the best whatever we have, we don't give attention.
Yeah.
And the things what probably we don't possess, we crave for it.
Yeah.
I mean, that is the general rule, and that is the human nature. Except exception is kids, children. They are not corrupted till probably maybe few years at the time. They are very frank, and they know what they want. They hold on to the same tie, they want to do the same train, they want to do the same cloth, because they know they are comfortable with that. But human nature is different. Now in your 30s, even because I have gone through that stage, 30, 40s, it is like you have an aim to beat the world, to be a performer, to be an ace.
Yeah.
Correct? So you are looking up.
Yeah.
At that is time, you don't look down. So your concentration is on that particular priorities are set. But as you keep doing that, there's one more thing which will happen. Like body organ functions, they try to start coming down by about 1% or 2 from the age of 35, 40 onwards. The discs, they start degenerating from late 20s. Correct? So your lipids, etc., they start accumulating under your arteries from maybe 30, 40, etc., much earlier than that.
Yeah.
That what you call as the concept of what you call as the body aging has changed over a period of time.
Yeah.
If you probably look at people in maybe your grandfather or great grandfather, they used to walk 3-4 kilometers. They used to do their own, wash their own clothes. They used to want food which is prepared at home, and they never ran short of anything. But still, they had a reasonably good health. Probably they died of illnesses which are probably where they are not curable. Cancer was there, but maybe infective illnesses, etc. Now, when probably you look at that, even for a short distance, you take a two-wheeler. And if there is a thing you don't need to prepare, you probably order a Zomato or something like that. Whatever we eat, the food is calorie rich.
Yeah.
It is rich in nutrients. So naturally, you try to accumulate more than whatever you really need to do that part of it. And with a sedentary lifestyle, because somebody cannot be Everybody cannot have the type of job wherever they are fit. They need to probably sit and need to work. That is a mandatory part of it. So then definitely the nutrition takes the last part. Whatever is available is what you eat, but you need to keep working. And if you probably look at the stress levels, how they think about the disease is very important. If you look at animals, you look at they eat, they sleep, they procreate, and they reproduce, and ultimately they die. But when they are not doing that part of it, they eat, they hunt, and they probably relax.
Yeah.
So their stress works only at the time when, and they probably hunt, or being hunted, or at the time hunger, or maybe other type of environmental conditions like peak cold or severe cold, etc., etc. Weather changes and those challenges. And that is a thing, a realization. I think all of us we need to work. So it applies to me, it applies to you. But in this little bit of time, whatever you need to have, we need to make sure that the machine works. Even in airplane, they have to repair, they have to service, they have to put an engine. You need to keep continuously. You need to keep servicing that. Otherwise, you don't service, they're not going to function. So when that is required, you need to probably do with a little bit of time whatever you need to do that part of it. It is a sort of an understanding that what if the things they go wrong.
Yeah.
So prevention becomes better than cure. That's what you call as wellness is not a luxury. Wellness is a necessity.
Yeah.
Fitness is a necessity. It is like you are armed in case if the things are good.
True.
It's like you play a game of chess. What if with a time limit? You've got a very good army, everything is positioned. You run out of time. For me, I play chess on chess.com. At the time when I say, I got the entire army, I got more pieces, I got more points, I got a great position, I need to do, but I just run out and I lose the game.
Yeah.
So in life, when you get your money, you create your what you call as physical properties, monetary shares, or it can be real estate, or it can be anything for that matter. But if you don't have a sound body itself, because you need to be there to enjoy that part of it. So you yourself is the greatest wealth. So that's the reason why I said in the beginning, part of it, what is the greatest wealth we do is our self-confidence.
True.
And it is our independence. It is our reputation, what we carry. Our freedom to do things, what we want to do, with whom we want to do, to what extent we need to do, and how we want to do. It gives you the degree of freedom.
True.
And the greatest feeling a person probably can get is when you know that you are in the control of your life. I think you can probably mark my words. The greatest feeling a person has got is when you know that you have a control on your things, what you do, a control on your life. And that can come only when you need to do.
So since you spoke about stress every minute because you have done surgeries where even after the surgery people are working and then they are continuous, even though they are undergone surgery, they are keep on thinking of, working, and then they are meeting because, so here in the society where the success has been defined in terms of financial, in terms of the materialistic aspect. So when we are talking about real wealth, that is where you have mentioned the wellness is their wellness is their actual wealth they need to be focused on. So unfortunately here people would be focusing on more of the medical insurance, or the always illness gets attention. So here, even when I have a conversation with many of people, those who are into corporate, right, do you have stress? They said, I don't have stress, because they don't know, they are not realizing that they are in stress. At times I do ask questions, last time when did you take a break? They said maybe 3 months ago I had taken a break where I had gone to mall. And when I ask another question, right, so how are you saying when you don't have a stress? He said, no, I don't feel anything as such, because I am working, and every day in the morning I get up and then I go for a work, and then I work for some 13 hours or 14 hours a day, and then I come back, and then I be with family during weekends. I go out for for a mall or a movie and then come back. So this is what they say. And then as soon as they make this kind of statement, I post a question: do you recheck when the door is locked? Again, are you going back and checking whether I have locked the door or not? He said yes. Then are you forgetting things? Yes. He said yes. And then at times, are you getting angry? Yes. He said yes. So are you bombarding at your family? Yes. At times, yes. So this is where, and then even during the weekends, because out of missing the family, that's where they end up buying some of the toys for the children, and then they go to mall and they visit, and then they spend some time, and then they come back. When we talk about this wellness, when we talk about any wellness aspects, they say, I'm absolutely fine. So the biggest challenge in the society, they are thinking this wellness, as you said, this wellness is not for me. This wellness is only for people who are rich. And maybe I can relate, ideally when I was young, people used to say, diabetic only rich people disease.
Richmond disease.
Richmond disease.
Yeah.
That is what the comment. So so we are coming at the end of the discussion, the conclusion. Basically, what is your iSPAN moments?
That's
Because you spoke about the one scenario where when you were studying, you lost your father. That's where emotionally you took some kind of decision where you wanted to become a doctor. So, what is your iSPAN moment?
I think I will always say this thing. I've been damn lucky in my whole life. Every moment which turned out to be a sort of a disastrous moment, it gave a different path which led to prosperity.
Okay.
It led to a life of purpose. And those what you call as orbit changing phases of my life, which probably brought me to wherever I am today, I probably call as I'm damn lucky.
That means
There is an effort which is involved in that, but I was
the
lucky.
challenges in life that you have converted them as an opportunity.
Yes, but now at this time, success, it doesn't come by itself. It is like a team sport. It is like a team event. It is not a solo event.
Yeah.
When I probably start, I have to probably say where my gratitude goes. It is to our parents. My father, I studied at Jog Falls. We had we used to call them by initials like GSR, VAB, GSN, Narayan Bhatt, VA Bhatt, and Ramkrishnaya. They're great teachers who taught us so with so much of passion, with so much of commitment. That made me a good student. But there are a couple of people like Manjunath Bapat, we call as RMB, RM Bapat, and K.R. Subbarao, who gave a different perspective of life, thoroughness, how we need to be thorough, how we need to be passionate about where we want to do things. That is the best thing which I learned. When it comes to question of orthopedics, I think Dr. Srinivasan is one probably I am always grateful to him for guiding into or maybe inspiring to the field of orthopedics. Mm-hmm. The backbone of my practice has been my wife, Dr. Sunita.
Okay.
So she is a consultant anesthetist. She did her DA in Bangalore at the Command Hospital. Subsequently, she did work in NHS. She did her FRCA UK. That was in 1998. She did her DA UK. After she came back, she dedicated all her time, effort to build up the hospital and to support my practice at our hospital. And the grace of God, ultimately you have to be thankful to God for whatever happens.
Yeah.
And the one which probably makes me whatever I am today, it is just like a doctor is only recognized by his patients.
Exactly.
Like a teacher is recognized by his students.
Yeah.
And a coach is recognized by his talented wards.
Yeah.
So if I am successful today and wherever I am, I owe the entire success to all my patients, which probably I say with folded hands, I am grateful.
Yeah.
And my commitment has been there to all my patients. My commitment to my patients will continue to exist till the last day of my practice.
Yeah.
And I can probably say I'm very lucky. I'm very lucky to be a spot where I am.
So basically, we had Dr. Jayaram today, and then he has decoded his iSPAN moments with us. He has shared a lot of ups and downs where, at the initial stage when he was actually a 10th grade, and then he lost his father. That's where it was an emotional decision, because any decision for that matter, or if we are perceiving something where, we have to have a control on the mind, where when what the mind, ideally the body achieves what the mind believes. So that's where he has started, and then he has, that was his true calling also. In fact, that is what he has mentioned. And then he have achieved so much. During this discussion, we had a fantastic discussion with regards to, your journey, maybe.
I just forgot one part which I need to probably, I think I will just complete the part of it. I've got a daughter who did her biomedical engineering, and she did a biotechnology at RV, and now she did her biomedical engineering at Georgia Tech.
Yeah.
He joined a biomedical firm in US. He has been probably a better version of me and my wife combined together.
Yeah, yeah.
And she's been very hard worker, very enterprising.
Yeah.
And very recently, she had a promotion to as a director of strategic marketing in Massimo Corp.
Yeah, yeah.
And probably she is the youngest one to achieve that status.
Yeah.
And it's always what we do, it doesn't give that amount of happiness. If our children, if they achieve that part of it,
Yes, exactly.
and they become an extension of ourselves, the things whatever we could not do, we want our children to do that part. So what you do will probably make your parents proud.
Yeah.
And
Yeah.
this what your son does will make you proud and make you happy.
Exactly.
So I think I want to probably sign off on that note that I'm a proud father of Apurva Jayaram.
Yeah, yeah. Good to hear that. So, yes, again, thank you so much. And on Sunday, you made some time, and then you have
my
spent.
pleasure. It is my
Yes,
pleasure.
you have spent time with us. Thank
It's been
you so
a
much.
good Sunday.
Yes, thank you so much for spending time with us. Thank you again.
I wish for iSPAN and for all your efforts, etc.
Yeah.
Make a lot of people fit,
Yes.
happy, and resourceful and productive. I think that should be the
Yeah.
intention.
Thank
Good
you.
luck and all the best.
Yes. Thank you.